In this video, I will discuss a very important topic, motor neuron disease. So, motor neuron disease is a neurodegenerative disorder in which there is degeneration of the motor neurons. So, motor neurons are degenerated. The cause of this degeneration of motor neurons is unknown, and there is either upper motor neuron lesion or lower motor neuron lesion or features of both of upper and lower motor neuron lesions, especially in case of amyotrophic lateral sclerosis. There is muscle weakness, muscle wasting, and paralysis due to involvement of upper and lower motor neurons. There are different types of MND, the most common of which is amyotrophic lateral sclerosis. Amyotrophic lateral sclerosis is important because it has both upper motor neuron lesion features and lower motor neuron lesion features. These lower motor neuron lesion features are present in mostly upper limbs, while the upper motor neuron lesion features are present in the lower limbs. Second type is progressive bulbar palsy. Progressive bulbar palsy, as the name indicates, that it involves the brainstem. Therefore, there is involvement of speech and swallowing. So, patient has dysarthria, chewing difficulties, nasal speech, and dysphagia. These patients have worse prognosis and there is risk of always aspiration pneumonia. Primary lateral sclerosis. Primary lateral sclerosis is upper motor neuron lesion and it presents with spasticity and stiffness. It has better prognosis. Progressive muscular atrophy. It has only lower motor neuron features and it involves wasting and fasciculations of the muscles, and it has best prognosis among all of these types. So these are four types of motor neuron disease. Now we will discuss clinical features. Upper motor neuron signs and lower motor neuron signs are present depending on the type. There may be muscle spasticity, especially when there is upper motor neuron involvement. Hyperreflexia also in case of upper motor neuron involvement. There is positive Babinski, but also in case of upper motor neuron involvement. When there is lower motor neuron involvement, then there is muscle wasting, fasciculations. When you tape the muscle, then it fasciculates, muscles twitch, weakness, and there may be bulbar symptoms in case of progressive bulbar palsy. Bulbar symptoms include dysarthria, as I have told you, dysphagia, difficulty swallowing, and drooling of the saliva from the angle of the mouth, and there may be nasal speech. So I have told you there may be progressive bulbar palsy that involves these features, or there may be other types that either cause upper motor neuron lesion features or lower motor neuron lesion features, or amyotrophic lateral sclerosis causes both of these features. So there should be no sensory involvement. One of the main important point is there may be no sensory involvement. Cognition is mostly normal. Diagnosis. Clinical diagnosis. No single test can diagnose the motor neuron disease. So it is mainly clinical diagnosis. You can do EMG. EMG shows active denervation because motor neuron disease, in case of motor neuron disease, the motor neurons are degenerated and therefore there is active degeneration shown on electromyography, while MRI brain and spine should be done to rule out myelopathy, that is compression of the spinal cord. Therefore, this should be ruled out to diagnose motor neuron disease. And pulmonary function tests should be done because mainly the thing which is affected and leads to mortality is your ventilation. Management. There is no cure for this disease. you have to manage it conservatively. First one is riluzole. Riluzole is an NMDA receptor antagonist, and this riluzole increases the life expectancy to 3 months more. It increases 3 months survival more. Respiratory support is also required, especially BiPAP, especially during sleep because of fatigue of the respiratory muscles. Nutrition is also required because these patients have, especially with progressive bulbar palsy, these have dysphagia. Therefore, they may require an NG tube or a gastrostomy tube. For spasticity, when there is upper motor neuron lesion, you have to give baclofen, you can give botulinum toxin, and for drooling of the saliva, you have to give anticholinergics. Multidisciplinary care like physiotherapy, speech therapy, and palliative care treatment, because this is a disease that can't be cured. Therefore, you have to manage it with conservative approach. Therefore, palliative care treatment is also important. So this is all about motor neuron disease.